Hello, my name is Jim Dice. I'm the registered nurse and owner here at Twin Oaks Home Care. Welcome to the fall 2014 staff meeting. I have 17 areas that we're going to go ahead and cover. The agenda is on 2 pages, and you should have a couple handouts as well. Number one, this time of the year we always talk about winter safety. The snow is approaching. We have to drive a little differently in the wintertime. There are some things that we can do to be prepared when we're driving. Make sure that we're leaving early. Make sure that if we're going to be late that we're calling the office. Make sure that we have some supplies, extra supplies in our vehicle. You may get stuck at a house for a longer period of time. Wouldn't hurt to have some additional food, even some drinks to take with you, changes of clothes, maybe even some bathroom supplies, toiletries. Some of the 24-hour cases in the past, we have had evening shift that had to spend the night till we could get the next employee in there. Next, you want to check your tires, check the air pressures in your tires, because when it gets colder, that pressure tends to drop. If you need new tires, now's the time to get them. If you have a front-wheel drive vehicle, sometimes you only need 2 on the front that are going to be the actual tires that are pulling. Next, you want to make sure that you have your cell phone on you, and you want to make sure that it's charged. And your cell phone should be on while you are traveling to and from patients' houses, but they're not to be on when you're in a patient's house. There may be some delays. If there is, the most important thing I can tell you is communication. If our school district in our area goes on a 2-hour delay, we like to move our employees' schedules back on a 1-hour or 2-hour delay. It's safer. We want to make sure that our employees get there and help the clients, but we want to make sure that they get there safely. Also, if it is a patient that's a vulnerable patient and you do not have a 4-wheel drive vehicle, it isn't listed here, but there have been times when we have had to come to an employee's house, pick them up in a 4-wheel drive vehicle, and take them to that vulnerable patient's residence to work. We also would provide a 4-wheel drive vehicle to get them back home if the weather was still bad. Number 2, infection control. We cover this every fall as well. There is an annual TB training. Annual tuberculosis is on the rise. In other countries, it's as high as 4 out of 5 people that have active tuberculosis or test positive for tuberculosis, which there is a difference. Someone can actually have the disease, be a carrier, and it may lie dormant in their lungs for 20, 30, 40 years. But if you would ever have that and develop the symptoms of the productive cough, then a person would be considered active tuberculosis, and that's when they would have to wear masks, and that's when they could actually spread it to someone else. That's why we do TB testing to all employees on hire, and then annually after that. If you're due between now and spring, we'll try to get your TB test done today before you leave. Also, another infection that has been coming up more and more frequently is MRSA. That is methicillin-resistant Staph aureus. And what it is, it's very difficult to cure. It takes some stronger antibiotics. It could lead to several other problems, like with kidneys because of the stronger antibiotics and bowels. Basically, that is a contact transmission from bodily fluids. So if someone has MRSA in their urine or in their wound or in their sinuses, then we would take special precautions when touching that type of biohazardous waste is what it's considered. It would still be, using gloves at all times when we're touching it, making sure that when we take our gloves off, we're washing our hands right away, making sure that contaminated stuff is double bagged, placed in one bag, usually like a shop and save bag, and then placed in a garbage bag, and then those are tied off and taken out. The other one we want to touch base on, you're hearing it a lot more in the news lately, and just recently it has occurred here in the United States, is the Ebola virus that originated in the West Africa area. when a person comes in contact again with fluids, either through vomiting or through diarrhea of an infected person, they can catch that virus. It takes up to about 21 days for it to manifest itself. In the United States, people are put on like a house arrest kind of quarantine, to where they have to monitor their temperature for 21 days and have blood work done to either confirm or deny that they are positive or negative for the Ebola virus. So far it's been in Texas, and they have a case right now in New York. It could pop up anywhere. What my employees need to know are the signs and symptoms of what an Ebola is, which looks a lot like the flu virus. We're coming into flu season. And then we are not going to be taking care of any patients that have Ebola, known Ebola. Those will be actually taken to hospitals, and they will be in strict isolation. The CDC, which is the Centers for Disease Control, are providing us with new regulations on a daily and weekly basis on how to handle any person that has this type of virus. Also, there is an infection control log that we keep here at our office. Any employees or patients that develop certain types of infections, some infections are reportable to the Department of Health, some are not, but we do keep track of those here at our office. Number 3, the Office of Long-Term Living we participate with out of Harrisburg. They are in charge of all the waiver programs and options programs. About 70% of our clients receive waiver or options programs. That's through the Department of Public Welfare. They have certain policies and procedures that are in place that our company must maintain throughout the whole year in order to provide those services. I've listed just a couple of them there. The first one, letter A, is the prevention of abuse and exploitation. And that is our goal as a company to the clients that we serve. We want to prevent them from being abused, either by our employees or by their family members, or even self-abuse of certain patients that we run across. We are mandatory reporters, which means if you bring something to my attention that there is an abuse or an exploitation of a client, then we're going to be getting Adult Protective Services involved. We're also going to be making up reports to the Department of Health and to the Office of Long-Term Living. Now, what I need you to understand is that you can make a report on your own. You don't actually have to come through our office to make a report of either elderly abuse or child abuse. You can go straight to Adult Protective Services or Children Youth Services yourself. But I would rather you have me on your side whenever we're presenting this information to the Adult Protective Services or Children Youth Services. So I would rather us tackle that problem together. But the law says that you, as a provider, as an employee, can make those reports independently. Just so you know that if you don't ever feel comfortable coming to us, which would probably be the only case that I could think of, you could report that yourself. Letter B, preventing fraud and financial abuse, which is also abuse of a client. Not just fraud to them, to our patients, but fraud to the waiver programs. That would be people signing in and out accurate times, someone either misusing a patient's credit card or MAC card or checkbook or checking account. We're here to prevent those types of things. Anything that you would see or hear that, whether it's confirmed or not, should be brought to the office's attention so that we can further investigate that, and we don't hesitate calling the police in if necessary, because we're not police officers. We're registered nurses, and we provide health care. And then letter C, Adult Protective Services, which I already explained. We are mandatory reporters of adult abuses and neglect in the client's homes, and you can contact Adult Protective Services directly. Adult Protective Services is a free program that's there to protect the elderly in our community. That's not something that costs them anything. Number 4, reporting of critical incidences, which is very important. the Office of Long-Term Living and Department of Health, there are certain things that are listed that if we are aware of that are mandatory reportable events, and they consider them incidences. There is a handout on this. I have it listed here, letter A through F. A is the death, injury, or hospitalization as a result of absence of waiver services. If we were to do something or fail to do something that would cause a patient to die, be injured, or to be hospitalized, then that's a reportable offense. Letter B, allegations of abuse, neglect, exploitation, or abandonment, which means, there are people out there that we take care of that are bedfast. If the family decides they're just leaving for the day and they don't have someone with that patient and they require 24-hour care, then that's a type of abuse that would be reported. Again, you can report it through us, which I wish you would do, have us on your side, or you could report it independently. Letter C, any misconduct by any aging waiver service provider or their representative. That would be including the area agency on aging that we deal with, or us as a provider. If there's any misconduct on our part, that is reportable to the Office of Long-Term Living or the Department of Health. Letter D is elopement. That's whenever someone is actually taken out of their house and they shouldn't be removed for usually medical purposes. Letter E, any accident or injury that requires treatment beyond first aid. If someone were to fall and break a hip in their home, if someone were to burn themselves, have a serious burn injury, that would require hospitalization and treatment beyond just Neosporin and a Band-Aid. That's a reportable event. Also, letter F, incidences that result in temporary or permanent service termination that may place the client at risk. Now, that could be either a client's utilities. If we went into the home and there was no water, there was no heat, there was no electricity, a utility that is necessary for a person to stay at home, there was no sewage, something was broken and it wasn't working. Those are reportable events. Or if we were ever stop services and it would place a client at risk, that would also be a reportable event. Number 5, Twin Oaks Home Care has a quality management plan. What we do is to ensure that our clients are receiving the best care that they can receive, and that it's competent, and that the clients are satisfied with the care that they're receiving. We do what's called phone call spot checks. Every other month we either call our employees one month and check on them, or we call the clients and we check them. And we have a series of questions that we ask them regarding the services they're receiving. And if there are any complaints that come up at that point in time, then that's whenever management follows up on those complaints to see if it's something that needs to be resolved, to see if it's valid, to see if there's something that we should be doing that we're not doing. Most of the time it's, a patient's not happy with their current schedule. Either that, or they're not happy with not getting the same employee 80% of the time. And that's probably the biggest complaint that we have, is when I send one of my employees into a patient's home, they want that employee 7 days a week, 24 hours a day. Well, that's just unrealistic. We can't meet that expectation. No one can work 7 days a week. Our goal is to never schedule overtime. We want our employees to be able to enjoy their life outside of working for Twin Oaks Home Care. The other thing that we do is we do what's called on-site employee evaluations, where one of the supervisors will come to a client's home while you're scheduled there in the home, and they're looking for, whether or not we're doing the appropriate things. We're cleaning, we're making sure that we're feeding the patient, making sure that we're assisting the client with their medications, whatever's marked on the plan of care that we should be doing, making sure we're doing it. We just don't go into people's homes and sit on a couch the whole shift and then leave. That's not who we are. That's never been who we are. 90% of what we do is housekeeping. And if you've been with us for any length of time, over a week, you know that patients want us to come in there and they want us to clean while we're there. Number 6, our workplace violence policy. There is a handout that's attached. It's important for you to know how you are to respond if there is a workplace violence issue that comes up while you're in a home. What that is a criminal act that's done against you, an employee, at a patient's home. There are certain things that you need to do to protect yourself and to protect our company and to protect your client. Those are all listed in the policy. And then once you bring that to our attention, there are certain things that we need to do as management to protect you, to protect our client, to protect our company. I'm not going to review that policy in full. It's there for you to review. It's the workplace violence policy. And if you have any questions or concerns, please see us after the meeting regarding the workplace violence policy. Number 7, every year I like to do a review, just to make sure that every employee understands there are rules that we have to follow. I have them listed A through R, and these are very simple. A lot of them are just common sense, but if we don't review them, someone can say, well, you know what, I've completely forgot about that. So letter A, when you're at a home and a patient has a doctor's appointment, please call that doctor's appointment into our office. Why? Because you may be the only person that is able to drive that patient. So we have to make sure that you're scheduled there that day. We may have 2 other employees that are there that their husbands drop them off and they don't drive. Or we may have an employee there that doesn't have the right insurance on their vehicle, which our insurance covers it like an umbrella. It's called a hired non-owned auto insurance policy. So there's reasons behind each one of these. I just have to make sure you understand the basics and that you act and respond appropriately when you're faced with these situations. Letter B, your cell phone is to be off when you're in a client's home. There's nothing more disheartening than for me to get a phone call from a patient saying, Jim, the employee was here, she was on her cell phone the whole time she was here. Okay, that should never happen. These patients, whether they're paying for it or the state's paying for it, deserve quality care, and an employee going into a home being on their cell phone the whole time they're there is not quality care. So, your cell phone is to be off. Letter C, keep your purse in your car and your personal problems outside of a client's home. I don't want anyone taking things from your purse. I also don't want, when you go into a house, if you set your purse on someone's dirty floor, you're going to be carrying bacteria out to your vehicle. We don't want that. So just take your keys in. That'll get you in and out. Letter E, sign your paperwork each shift correctly and accurately. The shift times that we start clients' schedules are either at the top of the hour, at quarter after, at half past, which is 30, or quarter till, which is 45. Those are the only times we should be shining in and out. If it's 9 to 1, it's 9:00 to 1:00. If it's 9:15 to 1:15, it's 9:15 to 1:15 p.m. That's also black ink. And one of the most important things here in the beginning of this is sign your paperwork each shift. What I don't want is a month later for us to find out that you didn't do your paperwork. You're going to have to come into the office here and you're going to have to sign that paperwork. That's additional travel that we don't want you to do. So the only way around that is for you to sign those papers and those documents. There's only 2, the monthly and the daily flow sheet. Sign those while you're there that shift before you leave, 5 minutes before your shift ends. You don't want to fill those out at the beginning of your shift because people will think you're marking things and then not doing them. You could run into a problem and not get something done. And then the patients are calling in and complaining that you are marking things down on your form, but you're not actually doing them. And that's a valid complaint. And we would have to sit down and discuss that. The way to avoid that is do your documentation right before you leave the patient's house. Then you will only mark down the things that you did while you were there. Letter F, as I said, housekeeping is number 1 in our patient's eyes. You may go in and you have the patient, you've showered them, you've done their teeth, you gave them a back rub, you did their hair, and they look great, and the house is deplorable. When the family comes in, they're going to say, man, that home health aide doesn't do a very good job. On the other hand, you may go into a house, you do the housework, you never even touched mom, and the family's going to come in and they're going to say, well, that home health aide is the best home health aide we've ever had. And unfortunately, that's the way families think. I don't think we should think that way, but they think that way. So we have to keep that in mind, that housekeeping is just as important to the family as taking care of the patient. Although our policy is whatever the patient needs comes first, and then the house. And I explain that to every family on admission. Letter G. Errands for clients. We are permitted to go out for clients. 1 day a week, we are permitted to go to the closest grocery store for them if they have a list. And that list should be kept by all employees that are in there throughout the week on the kitchen counter or on the refrigerator, wherever they keep it. There is something that I want to add to this. We've been picking up a lot of patients through the Veterans Administration. We call them the VA clients. We're at about 25% of our total clients, and we're at 100 clients again now, are receiving VA benefits. It is against the policies for us to transport a VA client. We are not permitted to at any time. That's not covered under the VA policies. So anytime we can go to the store for them, we just cannot take them to the store. And if they're going to go to the doctor, then what we do is we either adjust our time later that day or move it to the next day. But we're not permitted to go transport them to the doctor as well. That has to be either them themselves or their family. They're responsible for that, not Twin Oaks Home Care. Letter H. Call the office if there's a problem in a client's home. That's important because I don't want to hear about it 3 months later whenever there's a problem in a patient's home. And it could have been handled, it could have been taken care of at that point in time. Letter I. Have a positive attitude and be friendly. Our attitude should be, I'm here to help. What can I do to help you? And you should be looking at the plan of care to see what we are permitted to do in the patient's home. You know, how they bathe, what kind of housework we're allowed to do, any meal restrictions that they may have, any ambulation restrictions that they may have, or any transfers. You know, how does this person transfer? Some people use sliding boards. Some people use you have to just supervise them. You have to keep your eyes on them. To some patients, you actually have to have your hand on them, and that's marked on every person's plan of care. Letter J. This is reviewed every year. Always call line 1, 724-438-1936. Do not ever call any other number to get a hold of Twin Oaks Home Care. If you do, you're going to be calling backdoor numbers that don't ring to anywhere. What we do at 4 o'clock is we transfer that line 1 over to a cell phone so that every evening, every night, and every weekend you can still get a hold of the on-call supervisor. And I tell families this as well. Always call line 1, 438-1936. Letter K. It's important for every employee to have voicemail or an answering machine and to return phone calls promptly to our office. Now, for years, I have said we would like a return phone call within 2 hours. I think we're better than that, and I think that our clients deserve better than that. So I'm going to say from here on out, I would like a return phone call from an employee within 1 hour. I haven't made that a policy yet, but I will do that very soon. I'm just giving you the heads up. That's coming. I have called employees whenever there's been a problem in a patient's home and I needed to speak to an employee. And I get this, their voicemail has not been set up yet. If you have a cell phone and you don't know how to set up your voicemail, either go to your local phone provider or call your local phone provider and have them walk you through that process. It's not difficult. All it takes is a couple numbers that you have to push in to set that up. But to have a cell phone and to not have the voicemail set up, that defeats the purpose of us being dependable. That's like having an answer machine in your home and not having it turned on. We have to be able to leave you messages. I can't call you 20 times to try and get a hold of you and it just rings and rings and rings and rings. I need to be able to leave you a message and to have you call us back when you get that message, and it should be within an hour. I'm going to say 2 at the most. Because we are too busy right now to function any other way. I don't have time, my secretaries don't have time to call employees 20 times to get a hold of them in 1 day. I would like for that to just happen once, and then we could run a lot smoother. We would be more efficient. Letter L. If there's a client on the floor, everyone knows we must call 911 or the family can actually pick that patient up off the floor. If they have a couple grandsons that live next door or son and they want to come over and get them up and they don't want to call an ambulance, that's fine, that's their choice. Our employees need to remember we are not permitted to do that. We are not permitted to do to pick up a patient off the floor. We're also not permitted to do any deadlift transfers. That's when a patient requires more than 50% of us to transfer them to help. Either they get a Hoyer lift, they get a sit to stand, they get a sliding board, or they stay in bed for that shift, because I do not want any of my employees getting hurt. I do not want a client ending up on the floor because my employee dropped them because they were too heavy during transfers. Next, letter M. Our policy for call-offs. What you need to remember is when you call off, it needs to be 8 hours before your shift, and it also needs to, you need to have that excuse into our office within 3 business days. Now, an employee is allowed 1 call-off in the first 90 days, unexcused. If you're able to get us the doctor slips in, then those don't count against you. However, if you call off an hour before your shift 3 or 4 times in a row, even though you got us a doctor slip, you didn't give us the 8-hour notice. So that could still count against you if you're not giving us enough time to get that shift covered for you. Letter N. Every employee, it's required for them to have direct deposit. If you at this point in time do not have direct deposit, you are to go to Walmart, is our suggestion, and get what's called a Bluebird card. We can load that card. It can be used as a credit card. It can be used as a MAC card. That is our policy across the board for every employee, and the reason that's in place is because